All right, let's dive right into this explainer. Today, we're bridging what honestly seems like an impossible gap: the terrifying, immediate reality of modern superbugs, the ancient philosophy of cosmic order, and the profound biological power of fasting. If you've ever felt like our modern medical system is treating you more like a data point than an actual human being, you are definitely not alone. And you're going to want to pay close attention to what we've unpacked for you today. So, the crucial point we absolutely must face right out of the gate is this staggering number: 39 million. Take a second to let that sink in. That is the projected number of global deaths directly attributable to antimicrobial resistance, or AMR, between 2025 and 2050. We are literally standing on the precipice of a world where our most relied upon medical tools just stop working.
Here's our agenda for understanding this crisis and how we can actually survive it. 1. The antibiotic emergency. 2. The illusion of care. 3. The whistleblower's price. 4. The cosmic operating system. 5. The biological reset. And finally, 6. Empowering the patient.
Let's start with Section 1, the antibiotic emergency. This is the growing global threat that's unraveling every major advance in modern medicine. On a microscopic level, these bacteria aren't just sitting around waiting to be destroyed. They are actively developing defense mechanisms to become superbugs. They use enzymatic degradation, which is literally breaking down the drugs we throw at them, and efflux pumps, which act like tiny bouncers, kicking the antibiotics right back out of the cell. And the crazy part? They're sharing this tactical knowledge with other bacteria, rendering our frontline treatments completely useless. And the timeline here is absolutely critical. The 2028 to 2030 window, that's not some distant deadline for a future generation to figure out. It is right around the corner. AMR is spreading from hospitals straight into our communities. A simple urinary tract infection that used to be totally treatable at home can now land a patient in the ICU with an untreatable superbug. Experts are projecting this could cause $100 trillion in economic loss and become an emergency 20 times more lethal than COVID-19. If we fail to get a handle on this, the steady, decades-long increase in global life expectancy we've all enjoyed is going to drastically reverse. We're facing a return to a really terrifying era where routine surgeries become impossible, and a simple scratch from a rosebush could literally be fatal. Which brings us to Section 2, the illusion of care. How exactly did our powerful, multi-trillion-dollar medical institutions allow this massive systemic vulnerability to happen in the first place? Well, the sources point to a massive systemic failure, which was heavily documented by Dr. Kadiyali Srivatsa, a highly experienced ICU and pediatric physician. He identified that our modern system relies way too much on pre-printed assessment sheets and rigid protocols. Instead of actually listening to a patient's unique story, the system reduces them to checkboxes. This statistical morality, treating human beings as mere data points, led to severe misdiagnoses, prolonged suffering, and the massive blind overprescription of antibiotics that basically fueled this entire superbug crisis. Moving to Section 3, the whistleblower's price. Recognizing these clinical wrongdoings that were causing real pain to patients, Dr. Srivatsa made a choice. He refused to remain silent. Objective documentary evidence shows exactly what happens when you challenge a broken system. When we look back at history, like when Rockefeller and the early allopathic medical movement caused pain and suffering by marginalizing traditional herbalists and homeopaths, using fear to persuade people into trusting allopathy, the public basically stayed silent. They didn't speak out. But when Dr. Srivatsa identified wrongdoing by nurses and doctors that was causing real suffering, he voiced his concerns. And the institutions, assuming no one was watching, they used their authority to reveal their true nature. They issued termination notices, they harassed and humiliated him, they ruined livelihoods, and completely failed to protect the sufferers or correct their own errors. But see, Dr. Srivatsa didn't do this for revenge. He did it because silence just allows cruelty to persist. And according to Hinduism, when institutions use their power to treat individuals as insignificant, that karma always comes back around. It's beautifully represented by the Tibetan Buddhist symbol of the endless knot, or Srivatsa. In fact, a prominent crop circle depicting that exact endless knot symbol appeared in the UK in August 2012, on the very day Dr. Srivatsa returned to the UK after 2 years in Germany. It was a cosmic reminder to humanity that karma returns, especially when you look at the current political and economic climate of the UK and the NHS. With rising unemployment, homelessness, crime, and the rapidly spreading threat of AMR, these modern medical institutions will soon be brought to their knees. It's a stark warning to act now to rectify the error. Treat others with respect, not because of who they are, but because of who you are. The person you humiliate today might just hold power over you tomorrow. This brings us to Section 4, the cosmic operating system. To find a way out of this looming crisis, Dr. Srivatsa had to look completely outside the box of modern medical protocols. He looked to the foundational laws of the universe, specifically the concept of dharma. Now, in this context, dharma is not some religious dogma. It is the cosmic operating system. It's the fundamental duty to sustain life and maintain natural order. The current medical chaos, which strips patients of their agency, is adharma. It's entropy and chaos. True dharma in healthcare is about restoring human free will and empowering the patient to actually heal, not just managing their sickness for profit. And this creates a really fascinating bridge across millennia. Well over 3,000 years ago, the ancient healer Charaka used herbs and nature to restore physical balance without creating dependency. Today, acting in that exact same dharmic tradition, Dr. Srivatsa is using 21st century AI, specifically his Dr. Maya system, to protect the vulnerable. Both are simply utilizing the tools of their time to empower the individual against an elite monopoly on health. Now, Section 5, the biological reset. Because restoring this balance isn't just a philosophical or digital concept, right? It requires a profound physical reset of our own biology to survive what's coming. Our modern lifestyle keeps us constantly fed, which means our bodies are virtually stuck in the first 4 hours of digestion. High insulin, constant energy storage, and systemic inflammation. But by compressing our eating window, say to 1 meal a day, we unlock these amazing later stages. We shift from storing fat to actively burning it. And right around hour 18, something truly miraculous happens inside your cells. That miracle is called autophagy. Think of your body as a busy warehouse. If the delivery trucks never stop arriving, the cleaning crew can never do their job. Autophagy is that cleaning crew. When you stop eating for 18 hours, your cells actively scavenge and dissolve damaged proteins, hiding viruses, and yes, even bacteria. This internal recycling program is honestly the closest thing we have to a fountain of youth. And this creates an ultimate transformation. In the fed state, your cells are like a wet sponge. They literally can't absorb anything more, which leads to insulin resistance and disease. But by the end of a 23-hour fast, coupled with a massive 1,300% spike in muscle-protecting human growth hormone, your cells become a dry sponge. Your body transforms from an inflamed, vulnerable system into an optimized, self-healing machine that is totally ready to absorb nutrients efficiently. Finally, Section 6, empowering the patient. Because ultimately, surviving the post-antibiotic era means we can no longer afford to be passive participants in a fragile, failing medical system. You gotta take the wheel. Using tools like Dr. Maya GPT to understand your symptoms is a great start, but you also absolutely must follow these 5 critical steps. Ask clear questions, keep a detailed list of your medications, always ask for and actually understand your test results, explore alternatives before blindly accepting hospital care, and demand informed consent for any surgical procedure. By doing this, you break the cycle of dependency, you empower yourself to challenge misdiagnoses, and protect your own body from unnecessary exposure to hospital-acquired superbugs. This all ties back to a profound piece of ancient wisdom from the Bhagavad Gita. You have the right to action, but never to the fruits of action. You see, karma isn't a magical punishment. It's about pure intention. It means doing your duty, your dharma, to protect yourself, to speak up against wrongdoing, and to safeguard your community through your own biological resilience, regardless of what the immediate outcome might be. Which leaves us with this final, vital question. Are you going to remain a silent statistic, dependent on a failing system that views you as just a number? Or will you take back your biological free will today? We have the knowledge to rectify the errors of the past, to heal ourselves and to survive the coming storm. But the choice to act, to learn, and to heal, that is entirely in your hands. Thanks for joining me on this explainer, and I truly hope this empowers you to take control of your health.